Hola amigos, feliz viernes. Hoy es viernes. Yo soy Rory y estoy contento de estar aquí contigo. I am getting ready to head down on our twice a year medical Spanish immersion trip to Costa Rica. This is our winter program, and we just traveled to Costa Rica. In the summer, we go to both Ecuador and Costa Rica. So I'm getting excited, but I wanted to squeeze in one more video viernes. Over the next couple of weeks, I might be a little less regular with my lessons just because it's a whole different schedule when we're on program. But anyway, we're going down. Everyone will be involved in like 20 hours a week of medical Spanish classes, and we'll have volunteer work in the morning, fun excursions on the weekends, and every night go home to your host family. So that's the nuts and bolts of our program. I leave tomorrow, and we've got a bunch of folks that are traveling with us, and everyone focused on their medical Spanish. So speaking of medical Spanish, we are continuing with our topic of women's health, our women's health series, and this is la menstruación en español, just kind of explaining periods in Spanish. So here we go. We've got algunas preguntas para empezar. ¿A qué edad tuvo su primer periodo? At what age did you have your first period? ¿Cuándo fue su último periodo menstrual? When was your last period? You don't really have to say menstrual. It's pretty common. We'll see some other words for period as well. And a quick linguistic note on period. There are two acceptable pronunciations and spellings for period. You could have it with an accented I, in which you'd say periodo, periodo. But periodo is equally acceptable. So, cada cuántos días tiene su regla? Here's our other word for period. Cada cuántos días tiene su regla? How often, or literally this is every how many days do you have your period, right? So essentially, how often do you have your period? Sus periodos son regulares o irregulares? So are they regular or irregular? When you ask that regular, irregular question, you're really talking about frequency. You're not talking about flow, heavy flow or light flow, that kind of thing, okay? ¿Por cuántos días normalmente tiene la regla? For how many days do you have your period? Los periodos son muy abundantes. Okay, abundante, abundant, sounds a little more flowery than it actually is our word for heavy. Okay, so los periodos son muy abundantes. So do you have heavy periods? ¿Cada cuánto tiempo tiene que cambiar su copa menstrual? So how often do you have to change your copa menstrual? Would be your menstrual cup, tampon, or toalla sanitaria, which would be like a pad, okay? Okay, so just a handful of questions. The opposite of abundante in this case would be leve. So periodos leves, okay? All right, let's look at some vocabulario útil for periodos. So we've got el abdomen, so abdomen, right? El endometrio, endometrium. El revestimiento del útero, so that's the uterine lining. Revestimiento. El útero, uterus. La espalda, back. La espalda baja o la cintura, lower back. La parte inferior del abdomen, so like the lower part of your abdomen, so lower stomach. La región lumbar, so is lumbar region. La sangre, blood. La vagina, vagina. Las hormonas, hormones. Las prostaglandinas, so prostaglandins. Las trompas de falopio, so fallopian tubes. Los fibromas, so fibroids, excuse me. Los muslos, your thighs. Y los ovarios, ovaries. Los óvulos, and the eggs, yeah? Ok, muy bien. Continuamos con más vocabulario útil. Ahora hablamos de síntomas y surtidos. Surtidos is the word for supplies, okay? So, empezamos con varios síntomas. El aumento de peso, weight gain. El dolor de cabeza, headaches. El dolor menstrual, so like period pain or menstrual pain. El dolor punzante, so like a stabbing pain. Sangrado menstrual normal, so like normal menstrual bleeding. El sangrado menstrual abundante, so heavy menstrual bleeding. La diarrea, diarrhea. La fatigue. La hinchazón, so swelling or bloating. La irritabilidad, irritability. La náusea, nausea. Las heces blandas, so like loose stools. Los calambres menstruales, so menstrual cramps. Los cólicos. Los cólicos is another common word for cramps, menstrual cramps. Okay? Los mareos, dizziness. Los periodos abundantes, so like heavy periods. Los periodos dolorosos, painful periods. Los periodos irregulares, so irregular periods, again irregular meaning frequency. Y algunos surtidos, so some of our supplies. We saw these in the previous slide, but la copa menstrual, so the menstrual cup. Las toallas sanitarias, pads, y los tampones, tampons. Okay, side note, cultural note, when my wife and daughters are traveling in Latin America with us, usually it's a lot harder to find tampons than it is to find pads. Okay, so it could be, it must just be a market thing. Fewer tampons are purchased than pads. So I'm not 100% sure how that translates to, folks who are in the process of acculturation here in the States. But something to keep in mind that definitely it's always something that the girls are joking about is that they just can't find tampons. All right, especially post-COVID, like supply chain stuff. All throughout Latin America, there's like tampon shortage. I guess that happened here in the States too. Okay, all right, anyway. ¿Por qué experimentamos los cólicos? Why menstrual cramps? What's going on? Okay. Durante su periodo menstrual, so during your period, un ovario suelta un óvulo. So an ovary releases an egg. Este proceso provoca unos cambios en las hormonas del cuerpo. So this process triggers some hormonal changes in your body. Estos cambios ayudan a preparar el útero para recibir un óvulo fertilizado. So these changes help prepare the uterus to receive a fertilized egg. Si no se implanta un óvulo en el útero, if an egg doesn't implant in the uterus, el cuerpo produce inflamación en la pelvis. So your body produces inflammation in your pelvis y causa contracciones en el útero and causes contractions in the uterus. Estas contracciones le ayudan al útero. So these contractions help the uterus soltar su revestimiento uterino. These help the uterus release the uterine lining. Okay? Estas contracciones y dolores pueden empezar una semana antes del periodo. So these contractions and pains can begin a week before the period y durante los primeros días del periodo and during the first few days of the period. ¿Qué intensidad de cólicos sería normal y fuera de lo normal? So we're talking about what intensity of cramps and stuff are normal and out of the norm. Okay? All right, el ciclo menstrual normal es de 28 días. So the normal menstrual cycle is 28 days. Empezando día 25 o 26, es normal empezar a sentir dolores menstruales leves. It's normal, so between days 25 and 26, it's normal to start to feel menstrual pain, light and moderate menstrual pain. Es incómodo, pero puede continuar con sus responsabilidades normales de la vida. So it's uncomfortable, but it doesn't affect your daily responsibilities. Okay? Puede sentir dolor, ardor y cólicos en la parte inferior del abdomen y en la espalda baja. So you can feel pain, burning, cramps en la parte inferior del abdomen, in the lower abdomen, y en la espalda baja, and in your lower back. Estos dolores normalmente duran entre 5 y 7 días. So these pains usually last 5 to 7 days. La mayoría de mujeres, so most women, pueden controlar ese dolor con 2 a 3 pastillas de ibuprofeno cada 4 a 6 horas. So most women can manage this pain with 2 to 3 ibuprofen every 4 to 6 hours. Si los dolores menstruales son muy intensos, if the menstrual pain is really intense, y necesita más ibuprofeno para controlarlo, and you need more ibuprofen to control it, es buena idea hacer una cita con su médica. It's a good idea to make an appointment with your doctor. ¿Qué cantidad de sangrado vaginal sería normal y fuera de lo normal? So, how much bleeding is normal and abnormal? Es normal tener sangrado menstrual que dura entre 2 y 7 días. So to have menstrual bleeding 2 to 7 days, okay? sus periodos menstruales duran Si sus periodos menstruales duran más que 7 días, debe consultar con su médico. So if your menstrual bleeding lasts more than 7 days, you should talk with your doctor. Si sangra tanto, if you bleed so much, que tiene que cambiar su tampón, let's say, or toalla sanitaria, or copa menstrual, después de solamente after only fill in the blank with hours, 1 hora, 2 horas, or whatever is your time range, okay? Debe consultar con su médico. You should consult with your doctor. All right. Estilo de vida y remedios caseros. So lifestyle stuff and home remedies for menstrual pain. Preste atención a sus hábitos de sueño durante sus periodos. So pay attention to your sleep habits during periods. Es importante dormir lo necesario. It's important to sleep, to get enough sleep. 8 horas en la noche, so 8 hours. ¿Verdad? La actividad física también puede ayudar a aliviar los cólicos y dolores menstruales. So physical activity can also help to alleviate menstrual pain and cramps. El calor también ayuda, so heat also helps. Un baño caliente, a hot bath, una compresa caliente, a hot pack, o una bolsa de agua caliente, one of those hot water bags, en el abdomen, in the abdomen, pueden ayudar a aliviar los dolores menstruales, can help alleviate menstrual pain. Algunos suplementos pueden ayudar también. So some supplements can help also. Los suplementos de magnesio, so magnesium supplements, la vitamina E, vitamin E supplements, omega 3, so omega 3, y la vitamina B and vitamin B pueden ayudar a aliviar los dolores menstruales, can help alleviate your menstrual pain. All right, y reducir el estrés también puede ayudar a aliviar los dolores menstruales. So reducing your stress can also help alleviate your menstrual pain. Ok, continuamos con otros tratamientos o tratamientos. Hay varias opciones para controlar el dolor y regular el sangrado menstrual. So there are several options to control pain and regulate menstrual bleeding. So let's get started. El ibuprofeno puede tomar 2 pastillas de 200 miligramos cada 4 horas para aliviar el dolor. So you can take two pills of 200 milligrams para aliviar el dolor, to alleviate the pain. La pastilla anticonceptiva. Las pastillas anticonceptivas pueden ayudar a regular el nivel de hormonas en el cuerpo. So birth control pills can help regulate the hormone level in the body. Y así regular sus periodos también. And in doing so, regulate your periods also. El DIU. El DIU, most people just call it the dispositivo. El dispositivo. But it's el dispositivo intrauterino. Okay? Es parecido a la pastilla anticonceptiva. So it's similar to the birth control pill. En que ayuda a regular el nivel de hormonas. In that it helps regulate your hormone level en el cuerpo y así regular los periodos. Hormone level in the body, and in doing so, help regulate your periods. Si no podemos aliviar, if we can't alleviate los dolores menstruales, o no podemos regular los periodos irregulares, or we can't control your irregular periods con estos tratamientos, with these treatments, sería buena idea consultar con una ginecóloga. It'd be a good idea to consult with a gynecologist. Okay, all right, so we've got a lot of frases, mucho vocabulario, but all around información básica, right, about periods. So unas tareas de conversar. So a few conversational homework activities here. So primero, use slide 2 to ask your partner about her periods. That was a slide about how often you have your periods, when did you start having periods, how long do they last, etc. Okay? And then jump to slides 6 and 7 and use that to help you explain what's normal and abnormal when it comes to menstrual bleeding and menstrual pain. And then use the final slides 8 and 9 to discuss recommendations for alleviating pain and regulating bleeding. Okay? Preguntas, if you've got questions, post them in the comments section below and we'll be happy to answer them for you. And if you need a conversation partner, be sure to head over to the Learning Medical Spanish Facebook group, put yourself out there and say, hey, I want a conversational buddy to talk about periods and menstrual cramping. All right, gracias por aprender español conmigo. Juntos mejoramos comunidades. Together we really do improve communities. Para más español, head over to the website, commongroundinternational.com. Para tomar un examen médico, head over to Certified Spanish and you can create a free account and take as many medical Spanish terminology tests as you would like. Hey, if you learned something new in this lesson, please take a second to subscribe to our channel and like the video. That's a great way for us to be able to share this information with others. It just helps with the algorithm and people seeing it, right? So we'd love to be able to help others talk about periods in Spanish. So like and subscribe, and that'll be great. Muchas gracias. Nos vemos pronto. Ciao.